Are there any products you should limit, stroke, stop completely to prepare for surgery? Question mark. Medication. Yes, there are. There are certain things we worry about. Different people worry about different stuff. There are certain things that we all worry about universally. Things like warfarin, basically. And there are newer sort of blood thinners like apixaban and things like that. So that's warfarin's pretty bad, but the other sort of blood thinners are things like aspirin, clopidogrel, you know what I'm saying, clopidogrel, I think the proper doctors call it, but it's clopidogrel to me, and things like that. So some doctors worry about aspirin and the sort of antiplatelet drugs, which are good for your heart because they stop your blood from clotting, but they're not so good for if you're having surgery because they make you bleed more. So those sorts of drugs are a bit of an issue, and it depends on the operation you're having. It depends on your surgeon. We've all got different views on it, but the blood thinning ones are probably the biggest problem ones. The other ones are things like steroids. Steroids delay wound healing. Things like if you've got diabetes, especially bad control, insulin, things like that. So we have to think about that and getting that under control depending on how bad your diabetes is. So there may be things we need to do. Most other medication is okay, although I wouldn't like to say that and then you go and have surgery and have some terrible complication and blame me because you didn't talk to your doctor about it because I said it was okay. So really talk to your doctor is the best thing to do. But most of the medication is okay to carry on taking. Some doctors worry about some things like St. John's wort and things like the sort of, what are they, sort of herbal, would it be herbal or sort of stuff that you can buy over the counter? They worry about these things because I think some of them can cause bleeding, so some doctors will have specific views about those. I haven't, probably because I haven't had any bad experiences with it. What tends to happen is you have a bad experience and someone says, oh, I'm on St. John's wort. No, well, that must have been the cause of the terrible complication. I'm going to make everything for everyone for the rest of my life not have St. John's wort. But whether there's evidence in it, that's another thing. So yeah, the main ones are the blood thinners, and the other ones you'd have to really talk to your doctor. Steroids and diabetes ones is are the sort of main ones. So if I just thumbs up myself, oh no, I think someone else thumbs up me. Oh, thank you.